Hey guys, so today I'm going to tell you a little bit about Tucker's birth. So when Tucker was born at 12:20, we didn't really expect anything. Everything seemed to be normal, nothing out of the ordinary. Looking at these pictures, I realized that he was a little bruised, and several hours later, my husband had told me that the cord was wrapped around his head, but I did not know at the time. And the first thing that we started to really notice was he wasn't eating. We had tried several different things. We tried breastfeeding, we tried bottle feeding. They even tried just kind of squirting milk into his mouth. That didn't work either. He wasn't really swallowing it. He just kind of let it sit there. He wasn't really moving, closing or opening his mouth like a typical baby would. So it was about 7 o'clock that night. They took him down to the nursery and they started, looking into the situation a little bit more. And about 7:30, they came in and told me that they were going to transfer him to another hospital. So this was about 25 minutes away from where we currently were and about an hour from our house. And then they told me that I could not go. And I was just heartbroken. I really wanted to go with him, of course, and I didn't want him to be by himself. And so, and they said, well, we'll let you go first thing in the morning. So I remember the doctor coming in and talking with me, and she was very so nice, and she was just telling me how, just get some rest. I know you want to go, but just get some rest, and then tomorrow you'll be rested and you'll be able to handle the situation. So then the next morning we got up and we went straight to the hospital. They had already done several different tests on him. They had done an MRI, which they did find a brain bleed, but they said that they didn't feel that this was associated with what's going on. So they continued to run tests and to try to figure out what was going on. About 2 days later, they came back and they told us that he had Pierre Robin syndrome, which can be associated with a couple things. One is a very small jaw, which Tucker had, and they said that that was the reason why he wasn't able to eat. Another thing is your tongue will go back into your airway, and they ask us to place him on his stomach or his side versus his back, which is complete opposite what they tell you in the hospital. So, about 2 days later, they decided the best course of action was to have a gtube placed. And while we were waiting for the surgery a couple days before, they brought in the stall for us to practice on how to feed it and how to change the Mickey and different things like that. And I remember just sitting there on the couch in the NICU thinking just this overwhelming of fear that I could not have a child with a gtube. And obviously I didn't really have much of a choice, but I do remember that fear. But God just gave me the strength to keep pressing on and just to keep going. And now it's just life as normal, and even several months after, it's just normal for us now. So at 9 days old, Tucker had his gtube surgery, and when he came out of surgery, he was on a ventilator, and that was very, very frightening. They told us that he would be on the ventilator for maybe a couple hours, possibly maybe that afternoon he might get off. His surgery was at 9, and it just kept getting later and later and later. And finally, about 5 in the morning, he finally was able to get off the ventilator. And I remember watching him cry with the vent on, and you couldn't really hear him, but you could see his mouth moving. And then there were several times where he was trying to, rip the cord off, and he was trying to pull at it. It was very stressful in that moment of him being on the vent. But once he got off, you know, we started increasing his feeds and things were growing great. And we were about 2 days away from going home. And I remember that I had gone to the bathroom and I came back and there was about 6 nurses standing around him, and they had him bagged, and I remember looking up at his heart monitor and the oxygen was at 0 and he was white as a ghost. I mean, it was just so frightening and so scary to see him like that. And then it happened again later that day, and this time, like, I just walked out of the room and started bawling, and I went to the waiting room, and I remember just sitting there crying. And a few minutes later, the chaplain came in and started praying with me, and you know, it was just, I remember being so upset that we weren't going to get to go home. You know, I remember being so upset because I knew that they weren't going to let us go home after this happened. You know, come to find out, what was happening was his secretions were getting built up, and they were stopping his airway, and which was allowing him to basically stop breathing. And now I think back on it, you know, I'm so thankful that God didn't allow us to go home, because if we had, Tucker wouldn't be here today. I know it was God's way of saying he's not ready yet. And so a little bit later that day, they came in and they talked to us, and they basically said that, you know, he can't go home like this. We either have 2 options. We have to put him on a trach, or we have to send him to another hospital. And I just wasn't quite ready to put him on a trach yet. Because for the most part he could breathe, but he did have those episodes where he did get, you know, stop breathing. But I just wasn't ready. I wanted a second opinion. So we started looking around, trying to find, you know, hospitals that would take him. And I called Shriners, but he wasn't stable enough. We finally found a hospital in Oklahoma City that said that they would take him. And so the next day we told the hospital that we were going to send him to Oklahoma City, and I really thought that it would be, you know, this was a Friday, so I thought it would be you know, Monday before they came and got him. But they actually came that afternoon, and they didn't allow anyone to go with him in the helicopter, so he went on his own. They put him in the helicopter, and it was about 2 hours away from where from our house, about an hour and 20 minutes from where we were. And we got up there. Of course, the helicopter beat us. And when we got there, you know, they had already ran some tests and done a few procedures on him. And, you know, they decided they were going to put him on some medicine. And we were in that hospital for about 9 days. So they put him on this medicine called Robenol, which basically dried up his secretions. So each day he kept having less and less episodes. So after 9 days in that hospital, a total of 32 days, 2 days before Christmas, they finally said that we could go home. And my boys and all of us were so excited because, you know, 2 days before Christmas, it was the best Christmas present ever. Well, I hope you guys enjoyed this lengthy video of Tucker and his birth story. Well, you guys have a great day, and thanks for watching. Bye-bye.